Thank you very much for viewing this video. We are going to discuss about community diagnosis. I am Angela Omondi, nurse educator. So what is community diagnosis? We shall see about that. The objective of our lesson today will be, by the end of this unit, you'll be able to define community diagnosis. Be able to explain how to plan a community diagnosis. Be able to describe how to develop and pretest tools for data collection. Explain how to execute the survey. You'll also need to state how to write and disseminate a community diagnosis report. We have to write a report after doing the whole exercise. And then after writing the report, we go back to the community for feedback. It's known as community feedback. In this lesson, there are some references, some books that we need to refer to because it is a summary of the whole thing. One of the books is by Chris W. et al., 2008, Community Health 4th edition, published in Nairobi by Amref. Basavatampa, 2008, Community Health Nursing 3rd edition, published in New Delhi by J.P. Brothers Medical Publishers Limited. The other reference is Claudia M.S. and Frances A.M. 2000, Community Health Nursing, Practice and Theory, 2nd edition, by Saunders Company, United States of America. The final book is Mugenda M. O. Mugenda G.A. Research Methods, Quantitative and Qualitative Approaches, 1999, by Arts Press, Nairobi, Kenya. What is community diagnosis? It is a quantitative and qualitative description of the health of citizens and factors which influence their health. It is a process whereby the health workers, together with members of the community, identify the community's priority health problems, and they come together, make plans of action, and implement them. So it identifies problems in the community, proposes areas for improvement, and stimulates action. To stimulate, the community were not aware that we had this problem. But because of community diagnosis, now you stimulate their thinking. Oh, so this is the problem. We need to do something about it. So it is based on collection and interpretation of relevant data. You don't just do it anyhowly. We must have a focus. What do we want to know about this community? For example, the age of the community, sex distribution of a population, social groups, the vital rates, the diseases, and any other thing which is related to health. I've talked about involving the community. So community participation is very, very important. They need to own the exercise. I cannot just live here because I am a nurse. I go to a community, I start doing things, and then I come and give them a report. No. Community ownership is the key. For them to implement what we have discussed about, they must own it. So there are 4 things that we need to consider for the community to participate fully. These are the 4 A's. Under primary health care, they are known as the four A's: acceptability, accessibility, affordability, and availability, using appropriate and local technologies. In the past, health workers used to think, we know it all. We are the ones who have gone to school. We go to a community, do things, go back. They will say, that one is for so and so. That one is for the nurses. But the community has to own it. That is very, very important in community diagnosis. So you want to go to the community, which is a group of people living in a set geographical area, sharing the same resources, having the same ideas, and all that. And then we diagnose, we identify health problems that may be occurring in that community. So in the community, we have different aspects, different areas in a community. One of them is social anatomy. This refers to the structure of the community according to socio-economic groups, professional groups, religion, is it rural or urban? The other aspect is social physiology. It refers to the functions of the community. This community, they are, like for example, you can say this community, they are farmers. Majority are farmers. Or you can say this community, they develop building blocks. That is a function of that community. Social pathology, it refers to the social deviation from the normal function, individually or as a group. Pathology means abnormal. There's some things they are doing which are not normal in a social setup. And it can be an individual or a community. Like for example, you go to a community, this group of people, they are substance abusers. That's a pathology. We don't expect a community to be abusing substance like alcohol, like bang. That's a social deviation. And then you have a social diagnosis, another aspect. Examining the health status of the community. Health status. You normally diagnose patients. They tell you about themselves, and then you say, you have malaria, you have typhoid. Now this one, we want to diagnose the community as a general. Where are they in the age distribution? What are they encompassing in that community? What are they experiencing? That's known as social diagnosis. And then you have social therapy. It refers to the community treatment or community health action. We have diagnosed a problem. So how do we treat it? Therapy. And this way now you use the available resources. You coordinate the efforts of all the agencies in that community. Like now we have the national government, we have the county government. Where do we need the national government to come in to treat a problem? Where do we need the county government to come in? You involve all the agencies to do that. And then the community should fully participate. So in a community, there are factors that determine health. These factors determine how healthy a community is. One of the factors is demographic data. Demography. Population. Do you have very young people in this community? Do you have many youth? Do you have the elderly? It will affect their health. Vital statistics. Death rates. Birth rates. Are they giving birth? Are many of them dying? Education. How many people in this community have gone to school? Because it has been known and researched that the higher the level of education, the more the community is healthy, because they are enlightened to come to hospitals, to go to health facilities, to seek health care, to seek health interventions. Occupations, what do? Are they teachers? Are they nurses? Are they farmers? Are they masons? So that we have all these people in that community, ensuring that all perspectives, all their needs are met. Religion. Are they Christians? Are they Muslims? Are they Hindus? Because there are some health aspects that are affected by the belief of the people in that community. Marital status, married, widows, widowers, divorced, separated. This also affects the health of a community. Immigration. How many people have come from other areas to join this community? They have come from other countries. They have come from other ethnic groups. And when they are coming here, what are they bringing to this community? Nutrition. What do they grow? Another factor. Do they keep animals? What do they eat? What is their eating pattern? How do they wean their children? Another factor is environment. Water sources, waste disposal, housing. Which type of houses do they live in? Culture is another factor. Some of our cultures are more detrimental to our health than being good. Some of them are very good, but there are others that affect our health. What are the common health problems in this area? It affects the health of that community. Education facilities. I talked about the level of education. Do they have education facilities in that area? And if they are there, how far are they from the community? Accessibility. Health facilities, another factor. If there are health facilities around that area, if somebody is not feeling well, do they have a place to go for services, for treatment? Are they exposed to preventive measures from these health facilities to prevent diseases? And finally, another factor is recreational facilities. We should not just be working throughout. We need to recreate, we need to relax, play some football, chat, watch some movies, run around. Because our bodies need exercise. Our brains also need to relax. Those are the factors that affect the health of a community. So in community diagnosis, we have the common type of survey we do. And the most common one is cross-sectional survey. It means you examine data at one point in time. For these 2 months, we are going to assess this community. So we are assessing data. During these 2 months, we analyze it and we interpret it using the same subjects. So when you talk about a community diagnosis, we also look at the contents. What do we look for? This refers to the information required for making the community diagnosis. If we miss this information, then it is not community diagnosis. Demographic data is very, very key. Information on present conditions, mortality rates, morbidity rates, very, very essential. What are the future potentials of this community? Fertility rate, live births, stillbirths. What are we seeing in the next 10 years about this community? Susceptibility to diseases, immunity. Do they have natural or acquired immunity? Do they take their children from immunization that is acquired? Do they suffer from some conditions in this community until their body now can develop some immune to that condition? In another aspect of the contents is nutrition. Nutrition is key in the health of a community. What is their nutritional status? Deficiencies. Do they suffer from marasmus, kwashiorkor? Do they have some of these deficiencies? And then information on the environment. Environment is very key. And here we have 2 types of environment, internal and external. Internal environment refers to health services available, sanitation, occupation, and all that affects health. And then we have the external environment. Here is education. We consider food, housing, culture, behavior, and beliefs. Now, we mentioned about the cultural beliefs. Our beliefs, they are good. Our great-grandparents believed in them. But as time went by, it was researched and realized that some of these beliefs are hurting us. So we need to find out these beliefs and see how to improve the community on cutting them off so that they remain healthy. Those that are good, we enhance them. So in community diagnosis also we are going to look at some few terminologies, terms that are used. When you talk about data, these are pieces of information or facts that are collected in scientific investigations. Scientific. I'll further talk about scientific as we get along. Why is it scientific? It's not a time to guess. You don't just guess things. It has to be done in a scientific way to reduce error and biases. So everything the researcher gathers is known as data, which can be quantitative or qualitative. And then you have another term, population. This is the entire group of individuals having a common observable characteristic. That's why you pick a community where they are together. They have some common characteristics. They share the same resources. So they share the same beliefs. That makes them a population. Another terminology is sampling. Sampling. This is the scientific process of selecting a number of individuals for a study in such a way that they represent the whole population. Maybe it's a population of 1,000. You cannot interview everybody, the 1,000. You need a group of them to be in the study. So for you to do that, we call that sampling. And there's a scientific way of doing it. You don't just guess. Because there are 1,000, I need 20. No, we calculate and then you get the correct number. So another word for sampling, or another definition, it is a scientific process of selecting a representative unit from a population. Cluster is another term. It is a selection of an intact group. Cluster, intact. We are going to deal with this village that forms a cluster. This is very possible when the population is in a large area. So you form clusters. And then you look at family. It's a group of people who are united by the ties of marriage, blood, or adoption. This one now they form a single household, interacting with each other in respective position. We have the father, we have the mother, we have the child, such kind of things. They share, they create, they maintain, common culture. And many more. And you realize some of these terms, you'll find them in research. So community diagnosis is a research. And there are a lot of things we share with the research process. Even some of these terms, you'll also find them in research. And then you have another terminology on vital rates. Vital means relating to life or concerned with life. So these rates are events, things that relate to biology or social events in a community. And then events refers to births, illnesses, deaths, marriages, and all that. So up to there, we have seen what community diagnosis is. And we know that this is, when we want to go to the community, this is what we want to do. There must be a focus. And we are dealing with a community. And we want to diagnose what could be the possible health problems in this area. And before we do that, you can't just walk in somebody's house, somebody's home, and start doing things. They have rights. The communities have rights. Even you as a researcher, they are rights. So we have to have ethical considerations when dealing with community diagnosis. So we need to take activities or to undertake activities that are not offensive to that community. The tools or instruments you are going to use to collect data should not be unappealing, should not be offensive to the people you are going to meet. They should not cause any physical, emotional, spiritual, or cultural harm to that community. So the following have to be considered under ethical considerations. 1, obtain permission to enter into the community boundaries. You must get permission. We have the Ministry of Health, we have research agencies, we have gatekeepers, the chiefs, all that. The heads of Nyumba Kumis, you must get permission in the right hierarchy until you reach the village. When you have been given permission to do that, obviously you have to explain to them what you are doing, what you expect to do, how will it help them, how is it beneficial to them. They say, yes, you're welcome. Now you have gone to the home. Seek informed consent. Before interviewing anybody, get their consent. Yes, they were prepared that you are coming to take information. Once you enter a home, seek their consent. Explain to them, tell them who you are, why you are there, what you are doing, the questions you are going to ask, the areas you are going to touch, and are they willing to participate? If they say yes, go ahead. If they don't, you don't feel offended. It is their right. Thank them and go to another household. When you have obtained consent, they have said yes, establish rapport, interact, form that relationship with them. And when you're going to explore sensitive areas, some questions may be sensitive to that family, notify them. This area I'm going to discuss with you, it's a bit sensitive. It's about this and this. If you feel offended or it is too personal, feel free to let me know and I allow you not to answer. Ensure confidentiality of the data collected. That's under ethical considerations. Nobody wants the information flown everywhere in the whole village. And one way of ensuring confidentiality is using codes. So no one can trace, this code was for house A, this code was for house B. No, so use codes and they need to know that information they are giving you is very confidential. You also need to select good interviewers. That's very key. Because if the interviewers don't do a good job, you will have wrong information, you will analyze and interpret wrong data, and you will give a wrong report. So you select them, and when this is possible and it is advisable, use the community members. Just tell the chief, I need this type of people to participate in my research. Form 4 leavers, very good in English. They can also translate in the local dialect and all that. Friendly, so that now the community members will give you their own, whom they'll identify with. You see, now we are going to ownership. They will see their own. This is so-and-so's son. This is so-and-so, so they'll see themselves in those people, in the interviewers. So let them give you the interviewers as long as they can meet the criteria, and then after being given the interviewers, the number you need, train them. They need to be trained on communication skills, questioning skills, and how to go about the whole process. So thank you very much for today's session. That's all for today. Don't forget to subscribe on this channel. We shall continue sharing more and more on community issues. And our next session now will start from the process of community diagnosis. Now we want to start it. How do we go about it? Click the subscription button. Thank you very much and see you again.